This is what we do when we redesign processes. And in the engineering point of view, they always call this process engineering, taking in consideration, and if you can see this example, they think about what the human will do, their reaction and their process. That's why they create this step. We put the label on medication because we think human can miss and see wrong. This is the definition of human factor engineering. You are considering the human now when you are designing things. That's why I kept saying to you, it's not new. It's something that we know we do. But I want you to now open your mind to see this in a more focused manner and identify that we human have this sort of limitation. Our ability sometimes will be distracted because of something else. This is a limitation of human. So when you design processes, you design things that you can stop or at least minimize the chance of that human making the same mistake again. This is a very good example. The two cases are good examples where you all are working on designing and considering. You're doing it, but you don't know. Now I want you to know what you're actually doing it and do more in that area. And purposely now, when you design process for it, you think about that human more when you design. You will actually be much better in that context. Thank you so much for sharing.
Thank you so much.
Any question online? Any comment? No?
I'm not sure about the size of the label.
Oh, size of the label.
Yes, because I think it's really small, right?
Oh, you should see the labeling
Yes.
on the ICU IVs, okay?
Yes.
They are even smaller.
Yes, it's really, maybe Dr. Ek said that we have to put a magnify for every nurse to magnify it.
You go to ICU, you see the label of the medication, it's even smaller.
This is a.
Agree?
I agree, but in ambulance, the equipment that's for ambulance is magnifier because of our staff is too old, and we have a long-sighted eyesight. Then this is the equipment that's necessary.
Okay, so thank you. She is taking consideration of the staff. And this is another good example of she understands the situation and the people who's doing the work. That is why you are creating solutions that is designed to solve human error. This is a good example, okay? Simple things, put magnifying glass. Yes, it's a very simple solution.
I will ask some question about this case. Before we check before operate. We check the drug for nurse. Should we check for the baby or adult? I think it's a check before. You have the process like this before?
Yes. For the adults, for the children, for any patient, we need to check. But by that time, when we inject, we need to see the label before injection. But sometimes they do like just spontaneous that didn't see clearly what is medication they holding and then with the patient they just inject. But sometimes it occurs when we label, but sometimes they might like gone. So after that, we also have another RCA and said that every time before we inject, we should call out out loud. What is that medication? How much dose you will give? So we try to implement this. Did practice to our department at the moment, but it's not entirely 100%. It's some staff does that, but some not. But we don't want to wait for another event to occur. So we try at the moment in the morning conference that we try to call out loud and then try to encourage everyone to practice like this. Because we know that everybody have limitation for their minds gone while they're working. Thank you.
Right. Thank you for the question. I understand your question. Was the paperwork correct? That means did we check the paperwork correctly? Did we prescribe the correct thing, then the correct dose? In this case, I like to believe that they have done everything correct. The error was when they were
I think not
diluting it.
paper. We should be see the drug.
Correct. This is not there last time.
The drug is not clear in the label. Why we use the drug for adult in the room or for baby? I don't know why.
So that is why human error is 100%.
As I'm a pediatrician, I have a few questions to ask. That what I know that we give muscle relaxants from time to times, and this thing is like a pre-filled medication prepared for the patient. And I'm not sure that why do we have to like prepare for different concentration, like adult like I'm not sure 2 milligram per ml, and for the children is about 1 milligram per ml. I think this thing maybe makes some confused why we are working. I'm not sure why do we have to have like different concentration.
Actually, for the 20 kilo, we can label as 2 milligram per ml as well, but we need to make sure that they are 3, because if we label as 2 milligram, we need to inject 1.5 ml, which is for the 5 cc syringe. Sometimes with the eye, like old eye people, maybe they cannot inject so accurate for the 1.5. So that's why they say 1 milligram. So inject 3 ml may be more accurate. But for the baby one, if the children less than 10 kilo, if you label 2 milligram per ml, it's very dangerous that we cannot inject that too accurate for the very little millimeters like that. So that's why. So we serious at less than 10, but I agree with you that 20 maybe don't need to label as 1 milligram per ml. Yes.
I think her question was about, do you not have a pre-fill?
Actually, we don't have a pre-fill because
Exactly.
no, we don't have a pre-fill. We need to prepare at that time. Manually, every case is, because it's dynamic, we have like 40 OR and we have new medication every day. One case, we need to prepare case by case. Before the end of the first case, we need to prepare the second case. So the nurse need to be like gather together, prepare and looking. But we also have to take care of the patient because the patient almost wake up. So that's why sometimes we don't have enough staff to look to look for the preparation, because one staff need to look at the patient. So that's why some bad thing like this might occur.
I know that.
Yes.
Because as a pediatrician, we have like some issue with pre-filled syringe or pre-filled medication because we are not used to it. As pediatrician, we like to calculate. So how much that we need or how much that we have to add for the IV fluid. So that's why I asked that, why do the adult patient have to this concentration, but in children have the other concentration? Sometimes it makes some confused, because I know that in the operation room there are many patients come and go, and I know that your job is very busy, so I'm not sure about the concentration, because right now I have some issues, some problems about the pre-filled saline also. So that's why I just want to know about the experience that you have made before. Thank you.
Thank you.
Okay. There's a question from online.
One case is like Rebecca. It's called Rebecca.
Okay, Rebecca, are you in the Zoom? Are you there? Rebecca.
I would like to ask, how do you disclose medication error to your patient or to his or her family?
I will ask question first. Rebecca, she already okay.
Okay.
Waiting for microphone first.
Yeah, you can open the camera.
Rebecca, she's open camera already for the microphone.
Yes, you can go on.
Okay, good afternoon. I would like to ask, how do you disclose medication error to your patient or to his or her family?
Sorry, can you ask again slower?
I would like to ask, how do you disclose or how do you inform the medication error to your patient, his or her family?
Very big, important question. I think, Rebecca, the first question to that is that do you even disclose? What's the policy? So if you disclose, then that is so how do you do that? I think that's the question.
How do we find out that we give the wrong medicine?
No, how do you tell the family?
Oh, thank you. I need to think because was like last year. Yeah, I think we should disclose, but I think this case we didn't inform the
Family.
family. I don't think so. It was already. I think they just wait for the patient to wake up and see that it's the patient safely, and then get the parents come to the recovery room, and that's it. I don't think they inform the family for that, but actually they should, even though the patient is safe. Yeah.
Do you have a follow-up question, Rebecca?
So I think they have the right to know
Yes.
the medication errors made.
Yes.
Thank you.
Yeah, I totally agree with you that they have the right to know, even though the outcome is good or bad, they should know that what happened in the OR. But it's also the big point that usually when the outcome is good, they just like keep it a secret to themselves and then no disclose anything to anyone. But actually this case we report in the department, but not for the family or for the parents. Yes.
Thank you.
Thank you, Rebecca. Very important question, which I try not to discuss it today, but I had that discussion before with a big group of people as well.
Yeah, I agree with Rebecca that whatever the result is good or bad, they have the right to know the situation, and we have to tell them that we already fixed this problem, and we have the improvement in that problem, and next time we will manage it like this.
I agree with you. From the patient and family's point of view, I cannot agree with you all anymore. But if you are going to be the boss of the hospital, that is a different glasses that he is wearing. So I think it is important that we share and be honest about our care, treatment, and regime and what has happened. This is just as much as you disclose about your surgery and what you do, for example. The amount of error in surgeries that I have seen, not just in wrong side surgery is nothing. So the amount of small errors that I've seen under or non-reported is plenty. I used to scrub for surgeons as well, so I've seen that happening. So, and there's a lot of case, right? But they will never disclose. They try and fix it. Sometimes it's already an injury, but it's never disclosed. So that has oftentimes happens too. So something to think about on that line. So disclosure, we will talk about it because I remember before COVID, I was in a conference. I think we spent 2 hours or so and debating about disclose or non-disclosure. So my final take to everybody is that disclosure is good. In order for everybody to comply, you have to make it a policy. It has to be part of your organization's policy. If not, you will have a long debate and you will have a long blame and it's never going to be over. So when I go in and do assessment for organization policy in a hospital, when I see that, the first thing I want to look at for some of those policies are, do you disclose things to your patient? And how much of disclosure we look for? It should be written in your policy. So if it is very little or no disclosure in your policy that is described there, then I know this hospital will not do a very good RCA. Why? Because they don't want the truth to be released and to be told. And therefore, even if you are staff there and try to do a lot of RCA, it's not going to work because the organization do not have a strong policy of disclosure. So when third party like me, if I go into the hospital, I look at the policies that you have. These are one of those things I look for. If you have a policy that strongly talks about disclosure, sharing with your patient, and all that, then I believe the whole organization has a strong will and a strong culture towards safety. And they will do a very good job in driving good reports, understanding the root causes, and changes to the policy or the processes you have. If you don't have that, then it's a very difficult thing. That's one of those key things I look for as an indicator for mindset change. I always go to the top and ask them, if you talk very well in front of the conferences and you're the big boss of the hospital, and you say, I do a lot of patient safety work, we are number one, we are fantastic, then I will look at your policy. Let the evidence speak. So this is how we, as a third party, assess people's work, and if they are truly leading the organization to that mindset sometimes. So other than the staff, we also look at the organizational perspective and whether we are doing the right thing towards patient safety or not in that context. So that's how we see it as a third party, usually. Okay, one more case.
The third case from Nakhon Nayok. Yes.